Obama's Healthcare Reform Solution, Prevention and the Public Option, Part 3 of 3. Why we need a public option. If the present FDA fights to disallow the division of the FDA, we will never be able to reduce healthcare costs. What we need is documented proof that maintaining the blood chemistry at 7.365 is helpful in the prevention of disease and sickness. Keep in mind, the existing FDA has no desire to prove this fact, because this knowledge would disrupt the existing status quo enjoyed by the pharmaceutical companies, and is more likely that the FDA will work to disprove this fact because of the close connection the members of the FDA have with the pharmaceutical companies. If we can just prove this one fact, then this value could become a marker for prevention and curing of disease and sickness. It must be understood that our bodies do the curing when the internal chemistry of the body is balanced and has a pH of 7.365 or higher. Drugs do not cure disease, but are designed to stimulate the body immune system, and the immune system is what fights the disease. If the body chemistry is already balanced, then there is no sickness or disease for the immune system to fight. The public option. In the public option, doctors would practice without malpractice insurance, would work in the public option for at least 10 years and get their educational expenses paid off. And during this time, they would still be accountable for their performance. But doctors in the public option would be trained in prevention. Malpractice would actually be more difficult in the public option because health solutions would be dictated by getting the pH to 7.365 without surgery and with nutritional supplements with no side effects. Conclusions and reality. The present FDA and most of the pharmaceutical, medical companies and owners of hospitals dread the day that we eliminate cancer and other diseases. As long as we have methods that work sometimes and are very expensive and are profitable, the FDA, medical, and pharmaceutical companies will try to maintain the status quo. In the 1950s, Dr. Salk found a vaccine that eliminated polio, and an entire industry disappeared overnight that supported people that got polio. Without disease and sickness, the reality is that hundreds of thousands of people could eventually lose their jobs, but the patient would be better served with lower health care costs.